COVID-19 was reported from Kerala. And also the day the World Health Organization declared COVID-19 as pandemic. This is a very relevant, occurrence. And the first meeting of the state level committee or the state level task force was held on 31st of January, and which resulted in number one, constitution of district level task force committee. Number two, awareness campaigns. And thirdly, screening of persons entering Mizoram at 6 designated screening points. And lastly, setting up of isolation wards in all the district hospitals. And the second thing is reconstitution of the state level task force under the chairmanship of the Chief Secretary to the Government of Mizoram. That was on 9th March 2020 in consultation with the Chief Minister and with the direction of the Chief Minister, Honorable Chief Minister. We constituted the state level task force committee under the chairmanship of the Chief Secretary. And thirdly, we constituted, on 9th March 2020, a very, very, important committee called the local level task force committee. This is extremely important, and it is the task force which is, instrumental in the local level. So after that, we formulated the standard operation procedure, SOP, prepared by Disaster Management and Rehabilitation Department. And after that, we constitute different subcommittee, for fighting the COVID-19. And on 23rd March 2020, I constituted a committee called Core Committee on setting up of the COVID-19. And laboratory was inaugurated, or we make it functional rather, on 7th of April. This is a very important, achievement. And secondly, we also constituted the management of dead bodies of COVID-19 and non-COVID-19 dead bodies, and it's a related issue that was constituted on 23rd March. Then COVID-19 medical operational team was constituted on 30th March. Then we also constituted a committee called Committee on Psychological and Social Guidance. That was on 1st April 2020. Then constitution of helpline related to mental health during crisis caused by COVID-19 on 23rd March 2020, and a consortium of psychiatrists and clinical psychologists offering counseling from all over Mizoram and outside the state. And as many as 1,524 people have received mental services from the helpline till 21st May 2020. And after that, we also constituted a medical advisory team headed by Honorable MLA and the Vice Chairman of the Health and Family Welfare Board, Dr. Thiam Sanga. Then that was followed by the formation of the Working Group Committee on COVID-19, chaired by the Principal Director, Health and Family Welfare Department. Then we also, constituted state-level field laboratory unit for COVID-19 that was constituted on 20th of May 2020. And in legal sector, legal framework for management of COVID-19 in Mizoram, we also adopted the Mizoram Epidemic Disease COVID-19 Regulation 2020 notified and Gazette issue on 17 March 2020 under the Epidemic Disease Act of 1897, Central Act 3 of 1897. Amendments to the regulation was notified and Gazette issued on 25th March 2020. Then enactment of Mizoram Containment of Prevention of COVID-19 Ordinance of 2020, number 1 of 2020, and published in Gazette issued number 247 on 3rd May 2020. Then in prevention measure, we know the screening of entrance into Mizoram began early in Mizoram, ahead of the national, measures. The date on which the screening began at various border checkpoints are as given below. Lengthy domestic airport screening was started from 1st of February 2020. I think we are the first, state doing this airport screening in the country. Then Zokotar border checkpoint on 4th February 2020, Korpuicho Tlabung border checkpoint on 10 February 2020, Vairengte, Bairabi, and Kokon border checkpoint on 12 February, then Kanhun border checkpoint on 19 February, and Siaha and Nathil district, that was in last week of February. So these are the, the screening measures that have been taken. Then bullet thermal bispectrum camera, this is, very, very important, has been procured and received by the department on 21st May 2020. This thermal camera can scan 10 people at one time for fever, that means elevated body temperature, and stand-alone thermal scanner phone number have been procured to screen people in outdoor settings such as border entry checkpoints. And this scanner can scan one person per second. This is a very quick, measures. And scanning can be done from a distance of 2 meters. And both the above mentioned devices have capabilities to record real-time data through WhatsApp and email. And in monitoring of quarantine persons, regular monitoring of person quarantined at various quarantine facilities, my medical team constituted at district level. And regarding this contact tracing, we have been, taking active initiative for contacts of all positive cases since 24th March 2020, when the first positive case for COVID-19 was diagnosed in Mizoram. So far, 328 people have been traced on account of their coming into contact with 3 positive cases: Mizoram 1, Meghalaya 1, and Delhi. Then, to strengthen the health system, system preparedness, some of the action taken by the state government are: number 1 is capacity building of all stakeholders. That means 3 days training on preparedness and response to coronavirus outbreak, organized on 5th to 7 February 2020 at Microbiology Demonstration Room at Mizoram Medical College, Falcon. Then, preparedness for COVID-19 review meeting held at Agartala, Tripura on 28 February, and national training of trainers for COVID-19 health at Delhi, organized by WHO and the Ministry of Health and Family Welfare on 6th of March by state health official. And state level training of trainers held at Directorate of Health Services Conference Hall, attended by CMOs and SMOs, District Medical Superintendent, on 14 March 2020. Trainers further trained medical officers, nurses, paramedics, and volunteers at district and block level too. Then 4 days training of 2 microbiologists and 2 technicians from Mizoram Medical College on real-time PCR at VRDL Silchar Medical College in the later part of March this year. Then 3-day training of 1 microbiologist and 2 laboratory technicians from ZMC at VRDL Silchar Medical College in the second week of May 2020. Then continuing of nursing education team from ZMC and SRHF has conducted 10 training sessions on various aspects on COVID-19 management for nurses, drivers, and Group D, and like workers of civil hospitals, ISOL, etc. Then information, education, and communication daily bulletin since 17 March 2020. The department releases COVID-19 bulletin daily, and this bulletin is uploaded on department website and disseminated through INPR Department of Mizoram. Then talk show hosted by local TV channel like Zonet, LPS, and DDK with leading medical and clinical expert in the states. And call center number 102 under NHM identified as dedicated COVID-19 helpline, and additional number of such and such also identified as helpline number. So these, helplines are opened 24 hours with assistance provided by trained experts, including medical personnel. So hoardings of awareness on COVID-19 put up at multiple places within the state, within the city of Aizawl, and video clips prepared by WHO, translated into local language and broadcasted through local cable providers, and speech by General Secretary WHO translated and dubbed, in Mizo language for wide dissemination. Then advisory issue was done like this, to Mizoram Kohan Committee regarding limitation of public gatherings, to MKCC to conduct awareness campaign on COVID-19. Then we issue to all government departments to provide hand washing facilities and hand sanitizers within their office premises. Then general advisories on COVID-19, travel, visits to hospital, suspension of operations of picnic spots, gyms, recreation facilities, and shopping malls, and Sport and Youth Services Department on organizing Poroskar Award ceremony, and IEC leaflets on COVID-19 printed and disseminated to general public. And I also would like to mention, the enhancement of diagnostic capabilities. This is extremely important. So establishment of COVID-19 laboratory at ZMC to perform a real-time PCR for detection of SARS-CoV-2 approved by Indian Council of Medical Research, that was approved on 7 April 2020. Then total number of samples tested between 7 April to 21st May 2020 is 257 samples, and 221 persons, all are negatives. And all district hospitals designated as sample collection center for COVID-19 PCR testing. Then rapid antibody testing, RAT, started from 1st May 2020 for surveillance only. and as many as 4,331 persons have been tested till 21st May 2020. Then another issue is readiness for facility-based COVID-19 case management. This also is important. Mizoram Medical College Hospital was declared as dedicated COVID-19 management facility with a total of 139 general beds. There are 29 ICU beds, 7 main ICU beds, and 15 makeshift ICU beds, and 7 surgical ICU beds. And on 11 May 2020, the following facilities were notified as COVID-19 management centers all over the state. Then COVID Care Center, that means CCC, for management of suspected and mild cases. And there are 237 beds. And also we introduced dedicated COVID Health Center, that means DCHC, for treatment of mild to moderate confirmed cases. We have 147 beds. Then also dedicated COVID hospital for treatment of severe cases. We have 110 beds. So in IT sector, we take some initiative like this. COVID-19, NIC, CC, NIC in portal, all RT, PCR, rapid antibody tests, conducting and sample collecting units are registered at this portal. All results are compulsorily uploaded. And Argia Setu application promoted to be downloaded and used by all. So these are some of the things which I would like to share at this time. But since I have some more, engagement just ahead of this time, so I may not be available now. So you please understand. Okay. Thank you so much.
Sir, thank you, sir. I would grab this opportunity to not only thank you, because it was so insightful for all of us to hear you. But if you have time for a question, sir,
yeah, you are welcome.
Like to pose one.
You can ask 2-3 questions now. After this, I think I have to post for another meeting. Yeah, you can ask me some question if you have.
Only one question, sir.
Yeah.
Sir, what is your vision for what the new normal looks like for us in a post-COVID-19 world? And how do you think schools, workplaces, and other institutions in Mizoram should approach return to normalcy, sir? Thank you.
It is very, very difficult to say now when it will be started, But anyway, the UGC directed all the, central university to work out, the possible dates on which they can start the examination. But anyway, as on now, I think we fixed a date for 15th of July next month to start for the exam. So I think this is the only initiative that I have received from the university. So anyway, we have nearly 30 colleges in Mizoram, and these colleges are all under the administration of the Mizoram University. So anyway, we have to see the situation, Then according to that, we'll take a decision.
Surely, sir. Surely we can say that the health and welfare of the people in Mizoram is in safe hands, and the government is trying to do its bit to ensure holistic tackling of issues related to combating COVID-19, sir. So right. Thankful to you.
Thank you so much. Thank you.
Thank you so much, sir, for giving us your time. And we know that you are very busy with this whole problem, and we also know that you are the brain for all the arrangements that has been made for the safety of Mizo people. And we really do appreciate you giving us this time. And we hope that Mizoram will be safe from COVID in the near future. And we do wish you a very successful time and tenure as health minister also. Thank you so much, sir.
Yeah, thank you so much once again. Thank you so much.
We have with us today Dr. Sushi Singh, who will be moderating the session. Dr. Singh has been an educationist for over 20 years and was CEO of Educom Foundation, founder director of S2 Education Champs, and the convener of the CSR Center for Excellence for BRICS Chamber of Commerce and Industry. And she is also managing director of her non-profit supporting girl-child education. She holds a PhD in environmental sciences and certificates from the Harvard Business School Executive Education and Lancaster University. We welcome Dr. Sushi. Now the session is in your hands.
First of all, a big thank you to you, Dr. Dickey, for introducing me. And I'll take this opportunity to welcome all the panelists and the viewers present on the webinar on Mizoram, a model state in India with novel strategies in combating COVID-19. It's a true pleasure to be moderating this panel of our leaders from all areas of society in Mizoram. In a moment like this, it takes concerted efforts from all stakeholders in the society working towards a common vision to be successful and overcome the unique circumstances we are all in. It is also a forum like these that we as a society build institutional memory on how we came together to tackle challenges so we are stronger and better suited to face future challenges. I would like to thank our dynamic Vice Chancellor, Mizoram University, Professor S. Rao, for organizing this forum, where our society's leader can communicate together in one voice and share how Mizoram has been tackling coronavirus and the socio-economic impact of being in lockdown. Until last week, Mizoram had no coronavirus patient minded. So we heard our Health Minister. In fact, we again, sincere thanks to Sir for his time and for sharing his vision. Dear all, please stay tuned as we proceed to our 4 parts of today's webinar. In section A, I shall be providing a brief introduction to all the panel members. And in part B, we shall be having a short and impactful panel discussion. In third section, we shall have a short question answer session. And this would be followed by the last part, a short concluding remark by Professor Dickey. So now stay with me as I take a next few minutes to introduce all our panelists for today's webinar. We will then proceed into individual view presentation from each of these panelists in the order that we present them today and the order on the poster for today's webinar. So it's my pleasure to introduce our second panelist, the head of the State Police Force, Poo SBK Singh IPS. Shri SBK Singh IPS, who is presently posted at DGP Mizoram, has been awarded the President Medal for Distinguished Services in 2012, Police Medal for Meritorious Services 2004, and Silver Medal in E-Governance 2014. He has held several important assignments in last 31 years of his services in Delhi Police and Cabinet Secretariat. In his last assignment as DGP in Arunachal Pradesh, he started first tourist police unit, launched Arunachal Suraksha mobile app, connected Arunachal Pradesh police with public on social media, got the sanction of 2,000 additional police force, and gave honorary promotion to 1,500 constable. That sounds wow. In the last 10 months as DGP of Mizoram Police, he has launched the first all-women police station in Mizoram, tourist police, e-challan for traffic, Mizoram Safety app, and social media Mizoram Police presence and a strategy to combat drug trafficking. He will be speaking today on the role of Mizoram Police in containing COVID-19 pandemic. Moving forward, we have our third panelist, who is the representative of the front warriors on the international border. We have with us the head of the Border Security Force, who is looking after the international border of Mizoram with Bangladesh, DIG BSF Poo Kuldeep Singh. Poo Singh is the Sector Commander BSF at Aizawl. Mr. Singh has 30 years of experience in various borders of the country, both the borders deployment and country insurgency operations. Today, he will be speaking on the topic BSF in Mizoram and COVID-19. Thank you for being with us. Moving forward, one of our key community leaders are there with us on the panel. We have joining us today the General Secretary of one of the largest NGOs in Mizoram, Young Mizoram Association, Professor Lal Noon Thulwanga. He is presently the Controller of Examinations, Mizoram University, and has a doctoral degree in environmental studies. Professor is presently the elected General Secretary in YMA, which has its branches in different states of India as well as abroad. He will be speaking about the role of YMA in the combat against COVID-19. Next in line, we have representative from churches as well. The church, being an integral part of the state of Mizoram, has its own importance, as it has always stood with the government at all times. So today, we will be listening to the wise word of Synod, Executive Secretary, Reverend K. Lauren Moya. The Reverend joined the services of Mizoram Presbyterian Synod as a pro-pastor in 1994 and was ordained as a pastor in December 1996. He was appointed as a faculty in Aizawl Theological College during 2002 to 2007 and also worked as the field secretary in Assam field. He is now one of the 3 executive secretaries of Mizoram Synod. He will be presenting on the role of churches in supporting government and community in facing COVID-19.
Churches is not there.
Is there? He will be speaking now. What happened? Audio is gone. It's not mute.
Over the command as Commander 23 Sector Assam Rifle in the state of Mizoram. Today, he will be talking about the role of border guarding forces in containing the spread of COVID-19 in the state of Mizoram. Thank you, Brigadier. Moving on, we have reps from media as well. A state's problem, development, discussion is incomplete without any mention of media. So today, to have a balanced view, we have with us none other than the Director of Jonet Cable TV Private Limited, Mr. L.V. Lalthang Luanga, also popularly known as Tato, a highly recognized personality in media world of Mizoram. He completed his Mass Comm degree from Delhi University and has been the brain behind many big events for youth in Mizoram like Mizo Idol, Miss Mizoram, etc. He was also awarded GQ, the 50 most influential young Indians in 2017. Today, he will be talking about the role of mass media in promoting positive awareness among the larger public in the fight against COVID-19. Thank you, Mr. Tato. For a balanced panel, we are also blessed to have a representative from academia, Professor Lalni Lauma, Department of Rural Development and Extension Education at Mizoram University. We all know that academia plays a vital role in the defining and clearly articulating the strength of the society. So today, we'll be listening to Professor Lalni Lauma, Department of Rural Development and Extension Education, Mizoram University, who will be speaking on how villages cope with the difficulties faced by them during lockdown. Due to scheduling conflicts, we could not have with us today 2 of our panelists, the stalwart retired chairman MPSC Reverend Joe Sangliana Colney, and our Health Secretary Poo H. Laling Moya IAS Secretary Healthcare. We will miss listening to their viewpoints today. However, Professor Dickey of Mizoram University, she's there. She has shown her concern regarding presentation of views on the topic, how the Mizo community prepares and faces the outbreak of COVID-19. So she will be taking over at his place. Dear panelists, thank you once again for sparing your valuable time with us. Now, it is time to move on part B, panel discussion. Now, for the next 90 minutes, we'll be hosting individual presentations from all of our panelists, after which we'll have a brief question and answer session with all of them. For today's panel discussion, after hearing the Honorable Minister of Health of the state of Mizoram, I'm sure you'd like to hear how various stakeholders are going to elaborate on various schemes and programs being implemented in the state as a part of preparedness of Mizoram and fight against COVID-19. So now I will hand it over to the State Police Head, Shri S.B.K. Singh IPS, Director General of Police, Mizoram. Mr. Singh, please.
Good afternoon, everyone. Before I start my presentation, I would like to start with a thank you note to Professor Rao for organizing this webinar. And we are safe in Mizoram. Thanks are due to the, of course, frontline warriors from the health department, from the police department, and other departments. Thanks is also due to the community leaders, leaders of the NGOs like YMA, the village level task force, and local level task force. I'm also thankful to the government of Mizoram, led by Honorable Chief Minister, Honorable Health Minister, Honorable Home Minister, the Chief Secretary, and the whole community of officials who are working for COVID-19. As you have already heard the Honorable Health Minister. So in this presentation, we had the chronology of events. One minute. Yes, in the chronology of events, the Honorable Minister has gone into details. So I would not like to elaborate on that, but we must say the matter was being taken up at the department level from January itself, but a high-level meeting took place on 9th March when we decided to block international and interstate entry and exit routes. In fact, only one gate remained open on international border. The first meeting, as you have already been informed, of the state-level task force under the Chief Secretary was held on 10th March. Mizoram epidemic disease regulation was notified on 17th March. Local and village level task force was constituted on 19th March. Janta curfew was announced, of course, on 22nd March. A state level task force declared lockdown on 22nd March. That was even before the lockdown announced by the Honorable Prime Minister, which started on 25th. And we closed the Lengpui airport on 23rd March. So the Mizoram government, the health department, as you have already heard, and the Mizoram government also took very early action so that we do not have a spread of COVID in Mizoram. The Mizoram government also formed task groups to monitor the progress on the ground, and it made almost as many as 12 task groups. These task groups are headed by very, very senior officers, and they, on daily basis, they monitor the areas allotted to them. Now, as far as police is concerned, we felt that where do we start our work? So it was not a normal policing activity. So we first identified the threats which pose threats to the spread of COVID in Mizoram. Mizoram as such was COVID free. The first case, as you have been just now been mentioned, happened on 24th. The gentleman had come from abroad. He was taken to hospital, and thereafter there was no positive case in Mizoram. So we thought of what are the possible threats as per the information and intelligence available with us. And we identified that most important is international travelers. So we got the list of international travelers who had reached Mizoram from February onwards, and testing of those started. And we took care of the travelers who used to travel from the Myanmar border also. Then this was the problem of Tablighi Jamaat. So we tested and did contact tracing of all the Tablighi Jamaat people here. Then the trucks entering Mizoram, the drivers and the handymen, they were real potential threat. So we took their records, their details, and they were tested on the ground at Varangte. Then I have mentioned already Myanmar. So subsequently, we closed the Jokhathar border, but also sealed the border totally with Assam Rifle. That we'll talk later. Then again from Bangladesh. Then persons entering from Assam, Tripura, and Manipur. Then persons returning from other states. They started returning in the month of May sometime, and so we had to redevelop, redesign our strategy. And that is why you will see even our deployment patterns have changed over the time. So now we identified our tasks based on the strategy, based on the threats given to us. First was the enforcement of lockdown, then sealing of international border, then sealing of interstate border, security at the reception facilities. Reception facilities were basically the places where the persons from outside were coming to Mizoram. That is Langpui Airport, Varbi Railway Station, and Varangte by road. Then we had to escort people from the reception facilities to quarantine centers, then security at quarantine centers, then contact tracing. Contact tracing is if anyone has been tested positive, who all he has met, with who all he traveled. So all those persons' details we took, we coordinated with health department, and then they tested it. And then coordination with health department, coordination with local level task force, coordination with village level task force, and supervision of our own units. Of course, we also indulged in miscellaneous tasks that will inform you in the end. So for the enforcement of lockdown, we deployed people all over the state, and we ensured that no one comes outside. Of course, this wouldn't have been possible without the support of the community and the NGOs and the churches. But in case someone violated it, we did not remain behind. We took action under various penal provisions of IPC, Disaster Management Act, and also the ordinance promulgated by the state government. So we arrested 117 persons for lockdown violations. We registered 33 cases. There were 8,266 violators of ordinance, in which we realized the fine of 18,74,500. Let me tell you, this is not a small amount for Mizoram. And we registered 12 cases. This was a very big challenge. So we registered 12 cases for a spread of false information on social media. And every time we arrested somebody, we gave a press release. So this was very well advertised so that we do not become victim of false information on social media. And of course, when I'm addressing this, I will take this opportunity to request everyone that they should spread this, and anything being spread by Mizoram, they should check it and then only forward the WhatsApp. So these are some of the photos of the lockdown which you can see at different places. Now the international border sealing, as I have told you, Mizoram-Myanmar border is the responsibility of Assam Rifle. We have Brigadier Assam Rifle who has done fabulous job. He will tell you in details, but I can only mention that we were also not far behind. So on the demand of the village level task force and the villagers and the government, we also established 61 duty points and deployed 252 police personnel only on Myanmar border. You can see these are some of the deployments and the photographs. Then on the Bangladesh border, I think most of the areas are fenced except some riverine border, which DIG BSF will talk about. So we had to deploy only very few in Talabong area, 5 police duty posts where we deployed 28 police personnel. This is the deployment you can see. The interstate border was a challenge for us because we did not have cases, but we started hearing of cases in Tripura. We started hearing of cases in Assam. we started hearing of cases in Manipur. So we deployed our people in these places. This was also recommended, and we followed it because there was also information that a lot of liquor is coming from Tripura and Assam. So we did not want, because consumption of liquor is going to be a problem, and anyway it is a provision there. So we had to stop that. So no movement of person on the interstate border. So you can see we established 33 duty posts and deployed 223 police personnel on Mizoram-Tripura border, and Mizoram-Assam border, 55 duty points and 255 police personnel. Mizoram-Manipur border, 8 duty points and 62 police personnel were deployed. And we were able to contain them very well. You can see the kind of arrangements and of course makeshift barricade that we have deployed. Now we come to the reception facilities. See, this was a new work which was being done by the police. And therefore, we decided that we will prepare ourselves. And in order to prepare, when we came to know that a total of over 10,000 people are going to come back to Mizoram, and let me inform you that till now, 10,381 persons, Mizo persons have already returned to Mizoram. 1,706 persons from other states are expected, and more than 1,500 persons are expected from outside India. So we are expecting another 3,200 persons from coming to Mizoram in next few days. So we established reception points at Varangte because they were coming by road. We established them at Varbi, where we have the train station, and at the Lengpu airport. We deployed sufficient number of police personnel, and you can see we not only briefed them, but we trained them. We trained them how to behave with these stranded persons who are coming back to Mizoram. They are not criminals. They are our brothers and sisters. So we have to be very, very polite. So these briefing and training sessions were organized. And of course, they worked very closely with health workers at these points. These are some of the photographs. You can see this is Varangte check gate. Now we decided to move them in what is called convoy. So the police moved with them so that nobody leaves the convoy and goes here and there. Of course, let me tell you, and this is a credit to the people of Mizoram, that they are highly disciplined and no one really left the convoy and went. But anyway, as a matter of abundant precaution, we did deploy the escort party with the convoy. The parties were also deployed when the non-Mizos were leaving the state. So in some cases, we escorted them up to Guwahati and left them in the train. So this was also a very great task. Then at the quarantine center, our police personnel were especially briefed and trained that they do not have to mix up with them. They have to perform duty outside so that they do not leave. And let me tell you, this is a unique and most unique thing in Mizoram, that in addition to the state quarantine facility, we have community quarantine facility, which has been provided by churches and other community leaders, and the home quarantine facility, which are very, very restricted, and these are supervised by local level task force also. Just for your information, we have 261 state quarantine centers and 4,416 persons are lodged there as we speak. We have 358 community quarantine centers, 3,286 persons are staying there, and 954 persons have been allowed by the committee to avail home quarantine. We have the 24-hour security at the state quarantine center and all the community quarantine centers. Of course, we have not been able to provide at the home quarantine center. That task has been taken over by the local level task force. So these are some of the photographs of the quarantine centers where people and police personnel have been deployed with local level task force also. The contact tracing, as I have told you, that this is it was a very new kind of job. And in fact, in other states, this has been done by the health department, but in Mizoram, we were asked to do it. So we roped in 15 new sub-inspectors who had joined Mizoram police after training. They are highly educated. Most of them are computer literate. So we trained them how to go about it. A special training was done. And this was under DIG Northern Range and SP Special Branch. And we did this contact tracing very beautifully. And we traced almost 2,482 contacts of the positive cases so far. The Tablighi Jamaat checking and contact tracing and their hotspot connections was really a challenge. You know, we got a list from Government of India that these are the people from Mizoram who were present in Nizamuddin area during that period. So we contacted everyone and then we found who are these people. We gave information to the health department and the health department checked. So it was a massive exercise. Fortunately, no Tablighi Jamaat contact was identified to be positive. Now, the force deployment, we had to control a lot of things. And as you can see, depending on the need, we have changed our points, we have changed our the deployment pattern. Without going into details, you can see the first deployment we made, it was only 1,720. We changed it in the first week on 6th April, it was 1,910. Then 11th April, 2,031. Then on 13th April, it was 2,094. Then again, we changed it to 2,484 on 16th April. And on 24th April, it was 2,864. Then again, 9th May, 2,706. 16th May, 2,940. And again, 27th May, 2,705. See, coordination and supervision, as I have told you, Mizoram can speak that the best coordination is available on the ground with the local level task force and village level task force with Mizoram police. And this was given, the local level task force were given powers when this was constituted on 19th March. And they came in large numbers and helped police and the administration in enforcing the lockdown. And this excellent coordination will be remembered by Mizoram police, and it is something which we can show not only to all states in India, but also all over the world. So they worked very closely with the village level task force and local level task force. As far as supervision is concerned, right from the day one, that is 23rd March, which was a Monday, every day I have held meetings with my officers and monitored, asked the situation on the ground and the deployment. And 4 hourly reports we have been asking about the deployment or any important incident which have taken place in the whole state. Not only that, we sent DIG level officers in the areas to visit them and check the arrangements on the ground. The SP level officers have made very frequent visits. The regular contacts have been made with the SPs and commandants sitting in police headquarters to keep their morals up. And the provisioning required now for the for the police people, we are organizing separately also. We have our own hospitals. We are trying to organize, we are trying to train our own nursing assistant, pharmacist, doctors to take care of corona, so that if required, we can also chip in. Let me tell you, these are some of the photographs of the meeting, which you can see in the middle. The meeting by the IG Law and Order, the visit by the DIG to the very border areas, and Mizoram police will never fall back and remain behind for the welfare of the people of the state. So way back in April only, we decided to contribute 1 day salary to the Chief Minister's Relief Fund, and we gave a check of 1 crore 41 lakhs on 14th April to Honorable Chief Minister Mizoram Thanga. Of course, before I end my session, I will only say that I am very thankful to Professor Rao, the Vice Chancellor of Mizoram University, Professor Dickey, who took so much of pain in organizing this, and of course, Dr. Susi, who has taken pains in introducing everyone and coming forward as a moderator. Thank you so much for listening to me. Thank you so much.
Thank you, Poo, as BK saying, for a very informative presentation indeed. For your information, let me tell you that we got many excellent and hats off from the viewers. It is heartening to learn that the police and community is working hand in hand against COVID-19, and we truly appreciate the valuable contribution of police force in the state of Mizoram by taking all possible measures. So moving on, we have now the international border of Mizoram with Bangladesh poses challenges due to heavy infiltration, and will now turn to DIG of BSF, Poo Kuldeep Singh, regarding tackling those challenges and ensuring safety of those on the front line during COVID-19. Poo Kuldeep Singh, please.
Firstly, good afternoon to everybody, and thank you, Mizoram University, for inviting us to this discussion. COVID-19 has hit the society, and it has had an impact on BSF also. And we have our duties on the border, and as per the role and task, and the important two roles and tasks which are very important for us during the COVID war, they promote the sense of security in the government, in the local border population. And second was, which is a regular task, is dominate the borders and prevent illegal entry into the state. So we are deployed on the western side of Mizoram, and we are deployed on the Indo-Bangladesh border. So when the COVID started, it was very important for us to promote the sense of confidence and security in the population which is residing on the border. For that, we started creating awareness in the border population. We had a lot of instructions from the state, we had a lot of instructions from the government, and our own headquarters were giving us instructions on the safety and the security and precautions which are required during this COVID. So since we had a lot of instructions and instructions with us, we tried to pass them to the locals at the border so that they could prevent themselves from getting infected, and they could take all the precautions required for this. Not only this, we taught them, we educated them about the use of the various protective equipments like masks, like sanitizing, like hygiene and sanitation, and thereby the people could good gear up themselves for this COVID. Thereafter, certain things which we could help them with in the initial stages were providing them with masks, say sanitizing equipment, gloves at certain places where we found due to the initial stages of lockdown, we provided them rations, water, and at places where we could, we also sanitized certain parts of the villages so that the people at the border, at least they are away from COVID. We must understand that border population is a very important part of BSF, and they are just like our family. So it is our responsibility for them we are responsible to them for their safety and security. Second part in this was domination of border to prevent illegal entry inside the country. Domination of border is a continuous effort. It cannot go up or down with the COVID or anything like that. The borders are being dominated 24/7 and 365 days without letting people come inside. And this was also important for the locals to understand. And that is when the awareness campaign started, that we told them not to mix up with the civilians, to the population on the other side, to avoid contacting them, to avoid going near the border. And in that, we were quite helped by the local task force, the state administration, the police. And I must say that local task force also did a very good job, rather a great job in the rear areas. For this, again, for domination of border, even all the entry points, exit points, that is what we call gates on the border, in the fencing were closed, so that generally people could not move ahead of the fence in that area. There were areas where the villages were right up to the border, on the border. We had special pickets there just to observe them, so that no kind of contact is maintained with the counterpart, people living on the other side of the border. The rivers and the nalas in this area are of use. We requested the civilians not to use the waterways, not to use their boats. We enforced that the boats should not be used, so that you really don't have any chance of people going on the other side or people coming from the other side. We were able to, important was, there are a lot of sensitive patches and vulnerable patches in our AOR. We had put extra manpower there. We started dominating them. Rather, the domination in that area was increased. Just to, our basic aim was that people should not, illegal movement of people should not be there from the Bangladesh side. And I must say, we have been 100% able to stop any movement from the other side. Special patrols, special boat patrols, special pickets were there, so that the people, the entire aim was dominating the border, was just that illegal crossing, illegal movement to our side should not be there, because we had information that there's a lot of COVID cases in Bangladesh side, and we not to allow them this side was more important for us. Another important part in this whole COVID management was to keep ourselves safe, and that was one thing which was required, because we have people coming from the others, coming from the leave. We have people staying together, a lot of in the barracks. So it was very important for us to keep our own men safe. So during this, a lot of emphasis was made by the HAR headquarters. They ensured that all the instructions issued by the government of India or the state government were implemented on the ground in letter and spirit. We had the visits of our additional DG, our Inspector General, the commandants, a regular visit of commandants and the company officers, state staff officers visiting the borders, interacting with the troops, informing them about everything. It was very important to inform our troops so that they could inform their families to stay safe. It was very important for their families to stay safe, because during this, the person on the leave could not be recalled. And the people here should be mentally alert and mentally confident that their families are safe. And by and large, we have been able to achieve that. We did not have any case of COVID till now in our own campuses. Secondly, anybody who is coming from leave was quarantined. Anybody whom we had a slight inkling that he could be infected, even though he was suffering from a normal, say, cough and cold, we would still quarantine him in the initial stages, so that we are not able to, we are able to contain it. And if required, we are able to identify the man. Movement outside the campuses for administration were all stopped. Only operational moves are taking place even now, and operational moves are also with all precaution, say the mask, the individual carrying the sanitizers, using of the gloves. We cannot say that we will not be able to mix with the population. We will not mix with the population, because that is part of the duty. But yet we will, we have taken all the precautions, so that even if we mix with the population, we are not getting it. There is a air gap between us and the population, so that this COVID chain is not chain is broken. Even presently, even people coming from outside, the quarantine is mandatory, and we are ensuring that the quarantine facilities are there with us. Our medical staff is on the job. They are right from the say the people coming from Assam side, or the even at our own transit camps. We have got medical staff who is working on prevention of COVID. Overall, till now, I'm again very thankful to the state administration, the police, the DGP police, for helping us in this, for our own administration also, and at places state has given us equipment like PPEs, so that we also strengthen our own infrastructure. Though we are trying to procure, or rather we have procured some, and we are trying to procure more equipment for our to fight COVID. But I'm again thankful to the state, the DGP and all that local administration for helping us to get through this COVID. One thing, wherever the BSF is deployed, it is again responsible to the society also. We are not something other than society. So we are taking all the precautions so that it doesn't spread within our campus, or from us to the others outside in the society. If we say after lockdown, say when the lockdown opens, how will it affect us, or how will what will we do? Firstly, our duties are not going to change. It'll going to remain the same. We have to work on the borders, and we have to be effective in dominating the borders, and we would continue to do so. Secondly, we would try that it is not these cases can come up anytime. One cannot deny that. However, we should be able to identify those people. We should be able to do what contact tracing, what the DGP sir said, and able to find out who are identify the people, so that we are able to treat them, so that it does not spread. As far as contact tracing is concerned, we have wherever the cases of COVID were found in BSF, immediately the messages were floated from there, and all those people who had come in contact with them were identified and quarantined. So in overall, for us, the life would go on like that, and we assure you that we would be doing our best to contain COVID in the border areas. And in the end, let me put it on record, the good work and the help given by the local task force, the state administration, the police, and everybody in the society to help us fight COVID on the borders. And Also, Professor Dickey and the Vice Chancellor, Mizo University, for allowing us to put our words. Thank you and Jai Hind.
Cannot hear them. I cannot hear them.
It's coming. Unmute.
Yeah, I was off internet. Thank you so much, Kuldeep Singh, for keeping Mizoram safe by lessening the threat of COVID-19 through Bangladesh border. And in fact, you have almost answered all the questions which I had in my mind to ask from you, literally. Great job and great synergy. It's high time that we recognize the gradual and subtle impact of non-profits in all spheres of societal growth. In the state of Mizoram, the YMA has played a pivotal role in educating and empowering the community in the fight against COVID-19. So let us now hear from General Secretary of IMA, Professor Lalnun Tuluanga, how this was achieved. Mr. General Secretary, please.
Thank you, Madam Moderator. I want to express my heartfelt thanks to the Vice Chancellor of Mizoram University, Professor KRS Sambasivarao, and Professor Lalbir Dikinhamte for organizing this kind of discussion. First of all, I would like to greet all the participants on behalf of the Central YMA. Before moving to the main topic, I want to highlight some of the history of Central YMA, or we can simply call this Young Mizo Association. This YMA is one of the biggest non-governmental organization in the world. Then earlier, it was popularly known as Young Lusa Association. This is the first name of this YMA. This name was changed in 1947 as Young Mizo Association. This YMA was established by the Christian missionaries and pioneer Mizo Christians. Now YMA attains 85 years from its inception to the society. See, this YMA, as I already mentioned, is a voluntary organization and has three mottos. The first one is proper utilization of leisure time. And the second motto is reverence of good Christian life. And the third motto is striving towards a holistic development of Mizo society. And the main agenda of this YMA is helping the needy. At present, this YMA has five sub-headquarters in the districts, and 3 is about to be open very soon. Then we have 48 different groups with 808 branches across the states, and also in the neighboring states like Assam, Meghalaya, Manipur, and Tripura. Then the numbers enrolled, as per the last year YMA General Conference, was about 446,623. That is the number of members we have, registered members under the Young Mizo Association. As we all know, when this COVID-19 pandemic occurs around the world and also in India, the pandemic does not spare the remote corner of the northeastern part of India. Under the YMA, this YMA play a very active role in combating the spread of this COVID-19 pandemic in the states, and was an integral part and play a pivotal role in the local level task force, village level task force, state level task force, and the district level task force. So that role played by WMA is very significant towards combating this COVID-19 pandemic. And WMA is a part and parcel of every committee formed by the states in combating this pandemic disease. So let me highlight some of the works taken up by WMA for this COVID pandemic combating. WMA has performed a duty for the prevention of this COVID outbreak in the states. As we all know, Mizoram has a long border. In the Indo-Myanmar, we have Myanmar. The Mizoram border shares is around 510 kilometers in the eastern sides. And on the western sides, we have 443 kilometers long borderline with Bangladesh. So within the small states with very long boundary with international, as well as we're having a long border with other states of India, we have set up this duty post. In Mizo, we used to call that Vanbu. That is the duty post along the border, whether it is international or the interstate border. So we have set up a border duty post totaling to 309 along the international as well as the interstate border. In all the duty posts along the Indo-Myanmar or the Indo-Bangladesh border and interstate border, the WMA volunteer performs 24 hours duty. Not only in the border areas, we also play a very active role in every locality or every villages in the state. The WMA has set up a duty post at the entrance of every villages and the exit of every villages for preventing this COVID outbreak from outside. So to strengthen this combat on the COVID-19 pandemic, the Central WMA pay a visit to all the duty posts along the border. Then in every branch performing their duty along the border, the Central WMA give a token of 5,000 rupees to each and every duty post. So every branch, most of the branch in the border area set up a duty post around 5 to 10, ranging from 5 to 10 duty posts. In each and every duty post, volunteers of around 5 to 10 personnel keep duty for 24 hours. Then to strengthen this combat on the COVID-19 duty at the border, besides monetary support, the Central WMA is also handing over these requirements, daily requirements like food, cereals, medicine, then these insect repellents, many items we have provided. Then this Silpolin also provided to this duty post. Then sub-headquarters group and branch WMA also lend their support to the border duty post by providing this rice, vegetables, and others. Then, meantime, many branches who are not performing the duty at the border post raise a donation or a fund for all the branch in the border areas. Then the donation or the fund they have raised is more than 20 lakhs. Those money were distributed equally to the all border duties areas. Then besides those besides those steps, WMA is also taken some few steps, like the free delivery of daily requirements to the needy. So during the lockdown period, no one is allowed to come out from their home to collect their daily requirements. This WMA volunteer collect those requirements from the shops, from big shops or small shop, petty shops and all. Then they have handed over those requirements to the needy. Delivery charge free. Then in some areas we have provided free rations to those needy people. Then during the lockdown period lockdown 1 to 4, our hospitals whether in the city or in the district or in sub-town, they're in need of this blood. Blood transfusion is very important for saving human life. During lockdown 1 to 4, YMA donated more than 199 units of blood to the blood bank to save the lives. Then we also take part in looking after or in maintaining the quarantine facility to be safe from visiting from outside, as well as to take up some security, duty. Many volunteers have come out and performed their duty in the quarantine facility for almost 24 hours. I've already highlighted some of the photographs in the border area. So these are the border area. See, in the first slide, we have seen the photographs here with this mouse I have kept, this pointer. This is Mizoram, this side, and the back side is Assam. They prepare a fence for preventing entering of people from outside the states. Then this is the flag of YMA. Down there is the river. The other side is Myanmar, and this side is India. These YMA volunteers keep a vigil on the border. They perform 24 hours duty. These are the duty posts. We don't have a proper, duty post facilities like the security personnel. Here they have slept. See, as I already mentioned, around 5 to 10 people, YMA volunteers are staying in this hut, in this duty post. At night time, 5 personnel kept duty. Daytime, they sleep in this duty post, and the remaining 5 personnel perform the duty during daytime. Then this is Karnafuli River. This side is Mizoram, and the other side is Bangladesh. These are the duty performed by the YMA volunteers through this ferry. Then our YMA volunteers give some requirements to the needy, free of cost, whether they might be urban poor or the rural poor people. They provide rice, dal, sugar, potato, free of cost. This is how we perform the duty. Then we also organize some sort of social gathering by maintaining social distancing. So we have teach or create awareness among the people and discuss how to take the steps in the rural areas as well as in the border areas. That kind of activities we have taken up. These are the duty posts. This is on the way to Manipur border. And here, these are the kitchens for cooking of our volunteers. So this is Myanmar, and this side is Mizoram. So we have performed this duty so as to make the state free from this COVID pandemic. Thank you very much.
Thank you, Professor. We have just heard of the seminal contribution of YMA in fighting against COVID-19 in Mizoram. Almost every registered member were almost everywhere at local level, village level, district level task force working hand in hand with government and police. Professor, kindly share your presentation with us to make us able to share it to the whole world. Now, let me add to the viewers joining us from outside Mizoram that during my 10 months stay in Mizoram, I have personally witnessed how this NGO has tried to touch the lives of each and every Mizo for the better. Kudos to them. So moving on, it's time to hear from an organization which has stood as another most important pillar in the state of Mizoram, in the social fabric of Mizoram. So may I request Reverend K. Lalrin Moya to speak on the role of churches in supporting government and community in facing COVID-19. Reverend, please.
Thank you very much, Moderator Dr. Susisi, for this wonderful opportunity to take part and briefly describe the role of the churches in Mizoram in supporting government and the community as a whole for combating the COVID-19 pandemic. And good afternoon, everyone who are participating this afternoon. But I'm not bringing with me any pictures as our NGO representative has done. And I'm also thankful to my friend Professor Labiak Dege Namte for inviting me to be with such respected high officials who are speakers of this webinar. Thank you, Professor. And I greet you all, my fellow participants, with my utmost sincerity. To start with what might be expected from me, respected moderator, let me begin with my first point. I want to give some 6 points in this expression of the role of the church. Number 1, adherence to order of lockdown and social distancing. As soon as the state government issued an order of total lockdown and of social distancing in the state, the churches authorities all over the state, all at once, issued appeal to local congregations, or what we may call as a smallest unit of church, for adherence to government's order. The state government's order was publicized on the 19th of March, if I remember correctly. That was Friday. And that particular evening, rather after dinner, it was a night, I, with one of our church leaders, the senior executive secretary of the Mizoram Presbyterian Church, we went to personally meet with the state Health Minister, Dr. Arlal Thangliana, in his place for further clarifications on the issues. And he very warmly welcomes us, and we had an ample time talking about the issue. Having heard from him, we made up our minds and called for what we named as a Synod Officers Meeting of the PCI Mizoram Synod. By PCI, PCI stands for the Presbyterian Church of India. It is by far the largest denomination of Christian churches in Mizoram. It has around 48 to 50% of the general population. Now, that church we resolved to appeal to all our local churches everywhere for adherence to the order issued by the state government for lockdown and social distancing. And other sister churches of different denominations also did the same. Due to lack of time, such our appeals to congregations all over the state could not be properly sent by normal means. So we had to do it by electronic media like WhatsApp and FBs for speedy deliverances of our appeal. Because of our appeal, the churches in Mizoram, who normally used to come together on Sundays by hundreds and thousands to worship God in the church premises, do not come that particular Sunday. That is on the 22nd of March, and it goes on likewise till today. Churches' offices were also closed from 23rd of March onward until the state government opens ways after 3 or 4 weeks for partial attendance in the office, that too with much care. More than 80% of the total populations of Mizoram are church members, and quite a large number of them gave obedience to the church leaders. Churches appeal to their members, therefore makes people stay at home without showing any attempt to contradict with government's order of lockdown and social distancing. Obedience on the part of church members to the leaders' appeal played a vital role, to my observation, for the success of lockdown and curfew in Mizoram. So the role of the churches in Mizoram is very unique, for it makes the government quite successful in its announcement of social distancing. And my second point, financial contributions for fight against COVID-19. Churches everywhere in Mizoram are open to contribute funds for fighting against COVID-19. Mizoram Presbyterian Church Synod, from its headquarters office, had spent a total of rupees 39,13,750, both to CM Relief Fund and directly to those who are starving due to the pandemic by cash and in kind. Besides, local churches also give out money for the same cause. Out of the existing 1,113 local churches, the amount spent by only 89 such local churches amount to 105 lakhs 44,246 rupees. Can you imagine how many more would be the amount of the remaining 1,024 churches? Financial expenditures for this issue from the Presbyterian Church alone, and that too are collected randomly at present, put together amounted to 144 lakhs 57,996 rupees. That is very close to 1.5 crores. It would surely be a big amount if collected properly. Again, the Baptist Church's expenditures for the same till May was more than 25 lakhs of rupees, and it is still increasing. And the known expenditure of the UPC Northeast India exceeds rupees 12 lakhs. Here, we must remember that the Salvation Army, the UPC of Mizoram, UPC means United Pentecostal Church. There are two different denominations, so to say, of United Pentecostal churches. One is the Northeast India and the other is Mizoram. And the Seventh-day Adventist churches, the Evangelical Church of Maryland, LEKBK, Lairam Isu Christa Baptist Kaukran, and the Roman Catholic Diocese also have done their parts in their own regions, the amount of which I do not know as of now, yet we should not forget them since they are doing very well. Therefore, I am not hesitant to say that the church's financial contributions to the community in facing against COVID-19 in Mizoram is quite a big amount, soaring higher now than the amount I have mentioned just now. Does the financial assistance from the churches, that would be crores of rupees, enormously strengthen the government and the general mass of the people in their fight against the COVID pandemic. And number three, educating people to stay calm and peaceful while being cautious. When the general mass of the people came to learn that one of the church leaders who came back from Amsterdam, the Netherlands, got the virus, people got panic. But many church leaders got to their knees and prayed for him. They approached local TV proprietors and spread messages, thereby soothing the community from fear of the pandemic. You know, panic-stricken people needs to be calmed down. Otherwise, they may invoke unruly behaviors, thereby resulting chaos in the society. But the efforts of church leaders and dynamic preachers by televising and broadcasting lively and timely messages across the state works very well. People looked to God and prayed for the particular context, and they became aware of the need to behave well and therefore able to obey government's ordinances. And my point number 4 is offering church premises for quarantine centers. After a month or two, the government's efforts to bring home citizens stranded in various parts of the country was about to be realized. For those coming home, state government approached churches to open their buildings, their premises, to be used as quarantine centers. Churches spread their arms to embrace those who come home in their buildings. So far, almost 100 church buildings and such premises are used as quarantine centers, free of cost, where thousands of our people coming home from different states are quarantined. And number 5, food supply for the quarantines. Some local churches take steps even further by feeding those quarantines in their buildings. As of now, it is yet difficult to give how many local churches give food supplies to those quarantined in their own premises. This is quite another exemplary support given by the churches to the government and the community at large in facing COVID-19. Of course, rooms, halls, and available places were offered to the local or district task force by the churches, and those quarantines are looked after by the local task forces. But the supply were given from the church, and in some places it could be given by families of those who are in the quarantine centers. Now, churches' contributions towards this very much lighten the financial burdens of the government as well as the community also. The state government must be thankful to the churches for the power it gains from them. Lastly, what shall be given as offering free recordings of talks and shows by the church. By saying this, I am particularizing one church denomination, that is the Presbyterian Church of Mizoram. The Presbyterian Church of Mizoram is having, among its various departments, it is having what has been called as the SINFO. That means the Synod Information Department. It has its own recording studio, and the state government, who constituted what is certainly called as the COVID committee. They approached the SINFO department and recorded how many times they have done now, 3 or 4 times. I do not remember how many times exactly. And free of cost, we recorded the talks, and those recorded videos were given out to the people to enlighten and to soothe the panic-stricken people, and also to teach the people how to handle with the situation. These 6 points, I should say, are the biggest contributions that I can point out right now as the role of the churches in combating against the COVID-19. Thank you, moderator.
Very well said, Reverend. Without pictures or presentation, you were too good. Your 6 points to me, in fact, were excellent, because it got a lot of hats off from the Mizoram viewers and other outside viewers. Thank you once again for being a part of our webinar. To me, your third point, educating people to stay calm and cautious, has been really commendable. Because the dedication and effort, this dedication and effort actually can be emulated across the country and the world. So moving ahead, in fact, indeed, we are truly indebted to the churches for not having only played a positive role in creating awareness, but also coming forward generously in providing community quarantine centers for stranded Mizo people coming home from outside the state. So moving on, we will now turn to Brigadier Vinod, Sector Commander on Assam Rifles, whose troops are deployed on the Myanmar border of Mizoram, ensuring no infiltration happens as our community faces the challenges of COVID-19. Let us hear his version. Brigadier Vinod, please.
Thank you. Good afternoon, Dr. Sushi ma'am. At the outset, I would like to convey my heartfelt thanks to Professor Sambasiva Rao, the Vice Chancellor, for having conceived this idea of hosting this webinar. In fact, I must share it was somewhere in early part of May in a interaction with the respected DGP sir, Sushi ma'am, Professor Sambasiva Rao and I, that this webinar was conceived. And then, of course, the relentless effort of Mizoram University has fructified today in this webinar being hosted. I am Brigadier Vinod. I take care of the Assam Rifle troops along the Indo-Myanmar border. We have got about 510 kilometers of the IMB to man, and I have got about 5,000 troops to do the task. For those of the listeners or who are watching this webinar from outside the state, a brief introduction of Assam Rifles and the state of Mizoram, as I have seen it since last about a year and a half or two, rather 2 years. First of all, the history of Mizoram and history of Assam Rifles are almost synonymous. We have been in the states since about 1890s, and the recorded history of Mizoram also starts somewhere around that time. As when I was reading one of the books written by one of the Britishers, they say that the history, what he had observed at that time of the Mizo people, they have got a great past, but no history till then. Having said that, it was the Assam Rifle officers who got the came here initially from outside. Along with them came the missionaries, and with that, the history of Mizoram and the history of Assam Rifles are closely joined, and that has been the way we have been functioning in the state even as on today. It is a very close and intimate relation between the troops and the local population. Now, certain uniqueness of Mizoram, as I have observed, though Mizoram ranks about 24th in terms of size and 28 amongst the 29 states of India, but it has a lot to show to the others in terms of its discipline and certain other important qualities. If you were to analyze what is the basis of this, amongst all the northeastern states, probably Mizoram is the only most homogeneous state with all the single tribe dominating the entire population. I mean, the majority are all from the umbrella Zo community. Even the other small minor tribes are also somehow very closely related, both culturally and with tradition. So there is a common thought process and common social life amongst all the entire population. Second most important role has been of the religion. It is 97% is Christians, and the church has got a very, very, very important and significant role in the affairs of the daily lives of the people of the state. And related with this, the role of NGOs, which has been already been highlighted by the president of the YMA and the reverend who spoke before me. Having said that, I'll just move to my presentation. Now I'll briefly dwell upon how we have played our role in containing COVID menace in the state of Mizoram. We had actually our primary role in the contribution, rather the contribution in the entire situation has been in sealing the Indo-Myanmar border. Actually, if we were to analyze, this is a role which we have been doing since quite some time, basically to manage the Indo-Myanmar border. Now, one unique thing about the Indo-Myanmar border is that it functions under the ambient of free move regime. For those who are not very clearly about this, it is the population residing within 16 kilometers on the Indian side as well as on the Myanmar side have are free to move either side of the IMB. This is basically because with the premise that these borders are artificially created, whereas the tribal affinities existed long before these borders were created. So purely from a border guarding perspective, this makes my task a little bit more challenging. And this is the headings which I will be covering the short presentation. Well, Mizoram was a role model, or is still a role model as far as containment of COVID is concerned. We just had one case entering Mizoram on the 16th of March, and soon that also the single person who was COVID positive, he was cured, and the state continued to be COVID free till the first week of June, primarily because of the returnees who are coming from the other states. But I'm sure with concerted efforts of all of us, or the stakeholders, we will again fight this and we'll succeed, and we will continue to be the role model again. Mizoram has certain unique advantages. It has got very limited entry points from the rest of the country. With the interstate boundaries are very, very limited, and that had benefited to a large extent in containing the spread of COVID. Of course, I already mentioned the population by and large is very, very disciplined. It is takes me back to the time when we read history, when there was a threat to any particular village or a small place. The local youths in the yesteryears used to take up arms and fight like an army. And same spirit I find in the state, where the local youth under the ambit of or aegis of the YMA have made the local village level task force, and it is very heartening to see them manning not only the borders but the entry and exits of each and every village in the state. In fact, I have used my my work, my job takes me to various parts of the state. I have to travel quite a bit, and during these times, it is very heartening to see the young men and women sitting 24/7 and manning these posts in the entire state. Of course, the focus of ours was not sealing the entire borders, and also there was a threat of move of livestock, which could have caused the spread of these diseases. So, which we are looking after. Since our reach is in some of the most remotest locations of the state, we have been providing medical assistance to the remote locations wherever we have we are there, and also in to the locations while we may not physically there, but when we found that the people were deprived of such facilities. We also provided assistance within our resources to the VLTFs, the police personnel, because most of the places we are sharing the same locations. We also have worked out a lot of contingencies. Should there be should we be called to chip in if the situation were to aggravate, by earmarking various relief columns, and we have stationed them. We have got, as on today, 6 relief columns located in various parts of the state. Also, a big role was that we found that a lot of our own ex-servicemen and Veer Naris were suffering during these times because of the lockdown. We reached out to them and we gave assistance in terms of basically rations and medical facilities. You can see certain the photos, how the borders were sealed and our troops manning these checkpoints or entry points. We also have this some kind of a project which is going on between India and Myanmar, where a lot of laborers on a daily basis are required to move across the border. So on the left hand side, you can see a man in the PPE every day checking these workers who are moving in back and forth across the IMB. while we have maintained the modality of our deployment has been, we have maintained a very dynamic deployment. What I meant by this dynamic deployment was, while it is very desirable to hold the entire border with a human chain, but it may not be feasible because the resources are very scarce in terms of manpower. So, but if you are to analyze, there are certain critical points and important locations which, if guarded, yield the same result. Like if there are 2-3 tracks emanating or coming from a border area and they merge at a particular place, because it's all mountainous terrain with limited tracks and most of them have very important choke points. If you have to hold these choke points, we can do the task with the same effectiveness. So we have been maintaining a very dynamic deployment, but our presence have been 24/7 because if you have to man a particular location, if you have to only do it on a timed basis, it wouldn't be effective. And we had profiled the areas which were based on their vulnerability, and we were focusing more on the more vulnerable areas. While yes, as already were brought out by the earlier speakers, there were the NGOs, the state police, and us, that is the border guarding forces, had to work in very synergized methodology. So we reached out to all of them, including the VCPs of the villages, and we have devised a methodology wherein we work in a synergized manner so that our efforts are focused on the task in hand. These are some of the photographs where we have been interacting with the Veer Naris, the village level task force, the VCPs, medical camps. Now I was talking about the synergized approach. If you were to see this Venn diagram, these are the locations where we have an integrated approach, where the police force, the Assam Rifle, and the village level task force. If you see the first Venn diagram, at 10 locations, all 3 of us are located at the same place because of some constraints, some places. But this by no means is the sum total of all the village task force. There were a number of village task force in the state operating in the hinterland also. So this is by no means the sum total of the village task force or the deployment of the police, which has been already been highlighted by the DGP of the state. While yes, it is important that we work to contain the spread of COVID in the state, we also have seized of the aspect that we also have to ensure that we don't ourselves get affected. So for that, we also had to take a lot of measures, like our barracks had to ensure the social distancing. We had to reassure our own troops of the situation. Since we have a very way of community living in our day-to-day affairs, even having food, while having food, we had to maintain the social distance and our other force preservation methodologies. A big challenge was, of course, people coming back from leave. They are people coming from all over the country. So we had imposed very severe monitoring mechanism so that we ourselves don't become the carriers of COVID-19 into the state. This is by when the people are entering this, coming back from leave or any outside duty. We screen them thoroughly, right from the gate. The vehicles are sanitized before they enter our garrisons, and even the personnel are thoroughly sanitized so that the others are not infected. We also have created certain small innovations or modifications wherein we ensure that we are able to fight this pandemic in a very the way it should be. Like for example, the last one, we even created an app to ensure that the daily requirement of our troops for vegetable and grocery was centrally collected by in an app, and it was provided right at their doorstep. So I'll not go into the link, but there's an app which was posted on the Google. We also carried out a lot of training and creating awareness amongst our troops, right from how to maintain the hygiene of the premises, the internal security column. That's the same column which I was mentioning. Should I be called upon? How will we chip in by to ensure that the patients are evacuated without contaminating our own troops? And our own nursing staff were trained to handle these kind of situations. That's all. Thank you once again for giving me a patient hearing. Thank you.
Thank you, Brigadier Vinod. I think our moderator, Dr. Sushi's internet is not working. We are very happy with your presentation, and we know that many people are appreciating your presentation also. Now we have Mr. Elvira Tantuanga, Tato as we popularly call him. He will be sharing with us the role of the media in creating positive awareness among the masses. Yeah, welcome, Tato.
All right. Thank you, ma'am. Good afternoon, everyone. On behalf of Zonet Cable TV Private Limited,
Thank you, Brigadier. Thank you, Brigadier, for sharing a crisp presentation.
Thank you, ma'am.
Shall I go ahead?
Yeah, please go ahead, Tato.
Okay. So on behalf of Zonet Cable TV Private Limited, I convey my sincere gratitude to the Vice Chancellor and all his colleagues of the Mizoram University, my fellow speakers, and all the participants. I am very honored to be among these esteemed speakers today. Thank you, Mizoram University, for inviting me and giving me this wonderful opportunity. Today, I'll be using a PowerPoint presentation. Let me first share it. All right. So I'll first share about the current mass media situation in Mizoram. When we say mass media, there are three types which stands out and has a very big influence in Mizoram. First, we have broadcast media, wherein television is the main medium. Second, we have print media, under which generally we have newspapers and magazines. Third, we have internet, which has taken over other media forms as it forces a necessary change. I'll be stressing more on television as I'm from that background, but before that, a brief points on print and internet media. Okay, print media. Newspaper took a big hit after the lockdown as they had to circulate a digital version for a few weeks, which resulted in a loss of a sizable amount of traditional newspaper readers. The biggest Mizo daily newspaper called Vanglani resumed printing and distributing the print version only on the 28th of April. But after that, after resumed, it went on playing an important and pivotal, it went on, the newspaper played an important role in providing news and influencing readers. Next, we have internet. When we say internet, we mainly refer to social media. Social media has played a massive role, especially during this lockdown. This lockdown has created a new time of forced isolation, and the possibility of that becoming a strain in our mental health is real. Options to interact Mixing and socializing have been taken away. Having the ability to go online and see firsthand that you're not alone in this fight is really huge. I guess even the elderly people are more into their devices now. Huh? It's been an inspiration to see the world connecting, sharing positive stories, tips, and ways to get through this. That's when social media comes into its own, and when it truly connects, it motivates and it enhances our lives. It should be a force for good. Here are some of the most commonly used social media apps in Mizoram. We have WhatsApp, YouTube, Facebook, Instagram. Here's a new one, TikTok, right in the middle, the black one. This is a new sensation among these teenagers. I guess every teenagers here in Mizoram have this app, and then we have Twitter, and at the bottom we have these two new movie streaming app, Netflix, Prime Video. Other we have the Disney Hotstar, etc. But however, on the flip side, it's essential that we are all careful about how we use social media during this crisis, especially when it comes to the overload of information. Um, the sheer amount of information out there, including fake news, is now greater than ever. We've just heard the police taking actions regarding fake news. So at times it leads to overthinking and different forms of anxiety. So we have to be really, really careful with the sources in the internet. My company, Zonet, is also an internet service provider with around 1 gigabit bandwidth connectivity before the lockdown. But however, the demand for data has grown so much that 3/4 of the users have increased their data plans since the lockdown. So it has come to a point that our current bandwidth is simply not enough. So we decided to go for a new 2 gigabit bandwidth. That's like 100% increase, meaning the demand of internet has doubled over this period. Coming to my main point, television. Today I'll be focusing more on the impact that local Mizo channel has in the fight, against the COVID-19. Let me start with a brief scenario of the TV operations here in Mizoram. We have two dominant TV companies. One, as you've just seen, is LPS Vision, and the other is Zonet, which is us. We've got a good number of subscribers in most parts of the state. I shall be speaking extensively about Zonet's TV program. Okay, first we have news bulletin. As I mentioned earlier, the overload of information in social media demands a more reliable and accurate news. When people receive updates on their phones, the first thing they want to do is they usually want to confirm it. They usually want to confirm it in the evening news. We have even changed our news bulletin system by producing a live news bulletin since lockdown. As you can see, these are some of the images of our news bulletins. Next, we have the COVID-19 awareness. As mentioned by earlier speakers, ever since the pandemic news started, we have been broadcasting COVID-19 awareness programs given by officials and other concerned persons. We even had the health minister mentioned that. We even had that the health minister mentioned that part also. People now know more about the virus and its prevention. Hence, they have become more cautious. But however, in some cases, there seems to be instances of mass panic. Yes, next is an interesting part. The Gospel Home Crusade. This is a unique situation wherein gospel preachers preach through televisions, which receive a lot of positive feedback. The first home crusade was on the 25th March. If you could recall, 22nd March was the Janata Curfew. So the mood back then was really very tense. People were gloomy. They were physically and mentally stressed. I think we were seeking some kind of a divine intervention back then, yeah. Then there's this guy, young preacher named Frederick Lalrindika, the guy you're seeing on the screen right now, Frederick Lalrindika. This young guy started preaching on TV, and everyone started watching that home crusade. And one big sensation was that when the preacher asked viewers to shout in the name of the Lord, to call upon the Lord, viewers responded massively. They responded from their homes, and the simultaneous shouting was heard from outside everywhere. Numerous people have even claimed to be healed through this home crusade. In fact, the former chief minister of Mizoram was even one of them. Other preachers followed, and this home crusade program went on every night till the 3rd of May. It was more than a month. It was by far the most successful and valued TV program during this pandemic period. The influence it had on people was massive. It brings families together closer than ever. It helps overcome the fear of the diseases. Many people have confessed that they have even encountered an intimate relationship with God through this home crusade. As a Christian state, this home crusade had a positive psychological and physical impact on the society. It brought about hope and order. I think we let our faith overcome our fear. Faith overcome our fear, yeah. I'll also add that we increase broadcasting religious programs on our network because we can't go to churches anymore, which it has got a good viewership. This also. Next, we have economic awareness programs. After the home crusade, about a month of a total lockdown has passed. People started raising some economic issues. So as a media institution, we had to follow up. And make TV programs addressing the current economic situation. So some questions were even raised to the government. In fact, the Mizoram University Mizo Teachers Forum, I think I got it right, yeah, even submitted a suggestive economic measures to the state government, which was further discussed by a panel on the TV. I think you're seeing the same picture, the panelists of Mizoram University on the screen right now. So we've made a number of economic related programs later, and we plan to make a few more also. Yes, the next interesting feature, which the previous speakers has already mentioned, the border visit. One unique feature is, apart from the government details and the army detailment, borders were patrolled by the NGOs. So we visited these borders, Myanmar, Assam, Bangladesh, Tripura, and highlighted their efforts. The WMA General Secretary, the army people already mentioned that before, the army officers already mentioned this before. They in turn became very motivated, and people were aware of the border situation more than before. Yes. Next, we have the agriculture and allied interest. When I say this, our current situation demands a very sustainable economy. So we've made a TV program on agriculture and allied services. Working closely with the agriculture department, we've visited private and government initiative areas. In fact, one program, kitchen gardening, was one of the most successful programs. Now we see more and more youth picking up on this field, which is, I think, very important and very positive. Next, we come to education part. We also had some initiative on the education part. We've been working very closely with the Department of Education under the government of Mizoram, wherein we broadcast tutorial classes every day at 2 p.m. on our network. We even worked with the Mizoram University for 2 weeks, helping their online classes, broadcasting their tutorial classes. I guess some of you might be familiar with the professors on the screen right now. Yeah. Now, lastly, is the recreational programs we've made. It's the fun part, yeah. All the talks of the pandemic, the disease, the death, the positive cases took a toll on people. We were really bored about it. So we've made programs on recreational activities. We had a home workout video wherein viewers can join from their living room, doing a cardio workout on a local Mizo song, mind you, local Mizo songs, yeah. We also did something on a cooking show, which was really helpful. I think I'm myself into cooking now. Next, we have, yeah, we also did interesting thing, a children talent show. These kids, they did some wonderful things. These kids are amazing. It even motivates other kids also. I think these programs turned out to be a much needed shows in this crisis, people were, the viewers were having fun watching it. So I'll summarize by saying that considering all the points, we've concluded that mass media is an important tool for providing positive awareness to the larger public. I've also observed that our perception of heroes have changed. Before the pandemic crisis, we were, as a public, applauded and hyped singers, sportsmen, film stars, beauty queens, and social media influencers. But now things have changed. Post-COVID, the general public has recognized that the real heroes are our frontliners, our healthcare workers, essential workers, police, the army, the BSF, the academicians, NGOs, the churches, and we also learned to value the role of agriculturists and farmers. Thank you, everyone.
Thank you, Mr. Tato. Though I missed most part of your presentation, but the summary of representation said it all. The role of media in shaping up any situation in its right and wrong version is known to all of us, and its importance need not to be emphasized further. Here in Mizoram, Jonet Cable TV Private Limited and the media has played a key role in educating and helping the Mizo people to take informed decision in the fight against COVID-19. And we just heard from Mr. Tato himself. Mr. Tato, your active role on a daily basis to aid and assist the government by taking government preparedness to the public and people of Mizoram has been really praiseworthy.
Thank you.
So, moving on, I personally believe that the most unique aspect in the state preparedness for facing COVID-19 is the participation of community of the Mizoram wholeheartedly. And to throw light on this aspect, we were supposed to have Mr. Stalwart Reverend Joe Sangliana, and because of some reason, if he is not there for sharing his views, we have Mr. Dickey, please.
Thank you, Dr. Sushi. As the moderator has said, this time is supposed to be taken up by Reverend Zosang Lianakolni, but because of some health issue, he is not able to come physically. But at the same time, he has shared his views on how the community faced this pandemic. And we have already heard about the administrative, executive, and NGOs in charge, their role in fighting the COVID-19. And the main stakeholders, the community, has also to prepare itself to tackle whatever is coming with this pandemic. And the novel coronavirus, which is now commonly known as COVID-19, invaded our lives without any warning. And there cannot be any preparation as such because no one knows that it is coming. And the disease, or the virus as we call it, and its fatality was brought to our knowledge about round about February 2020, that is to the masses. But even at that time, although medical people, the government, and some knowledgeable persons, they were talking about the threat of this virus with its fatality, the mass, the common mass, the common people, we were at a stage of ignorance as well as denial. And we were feeling that this is something that will happen to other countries. That will, even if it comes to India, it will not come to a state like Mizoram, which is in the northeastern corner of India. So we were at the stage of ignorance, and we thought that this is not going to invade us. At the same time, government of Mizoram had started awareness campaign and using different media, and gradually came to that stage where lockdown was announced. And from that denial stage, the community became going into shock, a stage of shock, realizing that this is something that may happen to us. And then that the first case of COVID positive was publicized, and it was through the media that the community became to learn that this is something that is happening. And at that time, the shock, the stage of shock, made us very obedient, I should say, very obedient. And without questioning, everyone obeyed the government. the streets were deserted, and no one will go out of their house because they were scared that it will affect them. And I think we may also say here that Mizo community is totally communitarian, where everyone is, neighbors are visiting each other, and we visit each other, and we are close-knit society. But when that shock of knowing that the pandemic is affecting us, everyone stayed at home, and we became more and more alert to the threat of the virus. And when people stayed indoors, all activities came to a halt. And as we have said, in Mizo community, when someone dies, everyone will go to that place. But this stage gave us a thought that we should keep social distance. So we became obedient at that time. And churches were closed down, neighborhood gathering, visit to relatives' house, or any other kind of social interaction came to a standstill. This stage was a very difficult time, and everyone was scared at that time. Then we started understanding. So from that denial to shock, realization that we have to understand the impact that this may have on us. And we came to that stage of acceptance. Acceptance that we have to live with this pandemic, and we have to understand, and we have to learn to live with the threat. And one thing that is worth mentioning is that the people themselves, the community itself, would not like the curfew lifted when the deputy commissioner at one time talked about lifting the curfew to enable people to buy or do some kind of shopping. It was met with lots of objections, and the deputy commissioner has to again pull back that order of relaxing the curfew for that time. And how the community prepared itself is that initially, as I've said, it was at the stage of shock. And because of that, people started panic buying. And that panic buying, but in the end, led to sharing. People will start buying. But then they have come to learn that since we are communitarian society, someone may be there who needs the support of others. So whatever they have bought, they will share it with others. And this is one thing that is very unique about the Mizo community. And now the mental preparedness, we have come to that level where we are now mentally prepared also. And although we are still thinking that that we still have that wishful thinking that God will keep us away from all this, that if no one enters from outside, we can be free, which lasted for about 2 months. But now we know that people coming from outside, all the infected cases are from those people who come from outside. So we have to learn to live with that fact that this is going to invade us. And now with the present situation, the new lockdown, the total lockdown that is being imposed upon us, I'm sure that the community is going to live with the knowledge that this is very much in our midst. But if we fight, if we take care, if we maintain our health and our immunity, we will be able to fight the pandemic. Thank you.
Thank you, Professor Dickey. Thanks for sharing your views on community preparedness. After hearing her, we can say that not only other states in India, but the whole world needs to be emulating this format of community wholehearted participation in combating COVID-19. Thank you, Reverend, also for sharing your views through Professor Dickey. Now, moving on, it is rightly said that the heart of India lies within the villages, and the villages of Mizoram also form a very vibrant community. So let us hear from renowned professor of Mizoram University, Professor Lanli Lauma, how the villagers here in Mizoram prepared themselves to face COVID-19 challenges. Professor, please.
Greetings to all the panel members and participants. Firstly, I would like to thank our Honorable Vice Chancellor for coming up with this novel idea of bringing so many people in one platform to learn together about the Mizo way of responding to COVID-19. Secondly, I would like to thank Professor Dickey also for her hard work in materializing this program. Then I would like also to congratulate Dr. Sushi for nicely moderating the session. Yeah. Today, as mentioned, my presentation will be how villagers in Mizoram cope with COVID-19. As decided by Honorable Minister, Human Resource Development, our Vice Chancellor has appointed a 3-member study team comprised of Dr. Laltan Pui Ralte, Department of Public Administration, Mizoram University, Dr. Bilar Zarliana, Department of Sociology, Mizoram University, and myself. We took up a brief case study on the response of community towards COVID-19. So my presentation will mainly be based on the case study of selected villages. We selected 6 villages. I prepared PowerPoint, 8 slides PowerPoint presentation, but I don't know, let me try if it comes. If it doesn't, then I tried before, but it did not come really nicely. So let us see if it comes. Okay, anyway, it seems it doesn't work. So maybe I'll just go ahead without PowerPoint presentation. Yeah, my presentation is arranged in this way. Firstly, I'll talk about the little bit about the approach of the case study. Then second, composition of the local task force. Then the initiative of the local task force, and the impact of COVID-19 and coping strategies of the villagers. And the last part I would like to cover is good practices. But then due to limitation of times, I'll just select few points, make it short. So firstly, the approach we used in the study in simple way is like we selected 6 villages which are surrounding the Mizoram University campus. Then there we have 2 sets of information sources. One is the village level task force itself, for which we use a focus group discussion to get information. So we interacted with the local level task force members. Then another set of source of information is individuals in those particular villages. And those individuals included wage employers, farmers, and widows. So these 3 individuals, we interacted with them. But for these 3 individuals, we used case study method. So we interacted with them, then we studied their case, then we presented in the report. Okay, now let's go to the composition of the local task force. Everyone has been, most of the presenters have been talking about the local task force, but I think it would be still good to know the composition of the local task force. The village level task force or the local level task force is comprised of VC, village council or local council, as chairman. Then YMA, whoever is the president of that particular branch of YMA is the vice chairman of the local level task force. Then the other members include, we call it MUP, Mizo Upapol. They are senior citizens. So another is MHEP, which is Women, Mizo Women Association. Then another composition, another member is like a medical team. whoever is in the locality, a doctor or health worker or whoever is in that line, nurses or something like, I mean, like they are a member of the local task force. Then church representatives. So that means, let's say, if we have in a particular locality, if we have around 5 churches, different denomination, then we get 1 representative each from the churches in the locality. So here, the number of task force members in each location we visited, each community we visited, I'll just briefly mention about the numbers. In CP village, they have 23 task force members. And Slangpi also has the same number of task force members, 23, followed by Darlung village, which has 19 local task force members. Then Falcon village has 15 members. Then Tui Riel and Sakortui Chun villages have 12 members each. So these members are just a core group who will really supervise the deployment of the volunteers. And in most cases, the volunteers are YMA members. So if we have to count all these YMA members, then they may be around 50 to 60, like that. So they're all working together in the same community. All right, I think so much for the local task force because we don't have much time. Now let us see the initiatives of the local task force. I take only 3 points here. I mean, 3 initiatives here. The first one is awareness creation, which is very important. When we started learning about the outbreak of this coronavirus, COVID-19, the government is trying its best to create awareness. In support of that, the local task force also tried their level best to create awareness. One way is they create village WhatsApp groups. This has been very useful in giving information, awareness, sensitizing the people. WhatsApp group is very useful. Then we found a very useful tools in the community is public address system. I don't know if any other community in India have this. In Mizoram, we have this public address system in every locality, community. So whatever is important, like let's say tomorrow is lockdown, then they will make announcement from this public address system. And if there is curfew, it is announced through this public address system. So with all this, it's quite useful tools that the people are well informed. So when we ask the community whether they are aware of this pandemic and how to prevent and how to contain ourselves, they said, we are very much aware of it. So that is there. Then another thing is, just to highlight one incident in one village we visited is like awareness through soap distribution. One local task force distributed soap to every household in the village and informed them the importance of personal hygiene. So you have to wash your hands every time because during that time, it's even till today, it's very difficult to get the hand sanitizer. So at the village level, they created their own way of creating awareness on personal hygiene. So they started distributing soaps to every household. Then they teach them how to wash the hands and keep clean. So these are the tools which were used as very useful tools in the awareness creation. Then one interesting story in a village is like of an 80-year-old lady who is a widow. She stayed with her only daughter who is also blind. She said she made are living on the minor poultry farming. Then she also gets a national old age pension scheme. With that, she said she could survive because she doesn't have, the demand is not that much high. You know, the experience she showed is she doesn't have any phone which is compatible for this WhatsApp, village WhatsApp group. So she said she gets the information from the neighbors, the neighboring households. Then whenever she wants to listen to the news, she goes to the neighboring house and watch the TV and learn about the COVID-19. So those are interesting stories. So I would point out only that one for this awareness creation. Then another initiative of the local level task force is vigilance on movement. Yeah, as we all already heard about from the previous presenters, local task force take care of all the, you know, how do we call it, implementation of the lockdown. As soon as the state government announce the lockdown, then village level task force will really work on their best to control the movement within the community. Here, I'll just like to point out, if we can see the PowerPoint, that would be clearer, but then since it is not possible, I'll just read it out here. Here we have, in one particular village, CP village, they have 5 duty posts. See, imagine in one particular village, they have 5 duty posts to control the movement. Then in Tuirial village, they have 4 duty posts. Then another one is here, Falcon village has 7 duty posts, wherein they are, you know, these volunteers are placed to control the movement, to contain the COVID-19. Then another one is Darlung village have 3 duty posts. Sakortuichin also has 3 duty posts. Then Lengpui village also has 4 duty posts. So they are really into duty day and night, actually. In some cases, they said we have to be there overnight on duty. So they're really working hard. Then they take care of, during the lockdown, they look after their home quarantine. If they have home quarantine, they take care of the home quarantine. So that is that. Then another thing, another important initiative, the third one is delivery of essential commodities. See, the lockdown is declared, movement is possible in the village. So during that time, there are some households who have some stocks of food grains. But many households, they don't have food grain stock. Then what to do? So the local task force arranged this delivery of essential commodities. But how? They don't have any fund. The government has not given any fund for that. But, you know, it is really noble idea that many people come forward and give donation to the local task force. So here the amount of donation each locality, community receive, these are rough estimation. Sakortuichun village task force, they had a collection of 3.45 lakhs just from community. Then Lempui village, they have around 3.2 lakhs. Then Falcon village has around 1.9 lakhs. Then CP village has 1.7 lakhs. Darlung village has 1.3 lakhs. Tuirial village has 80,000. So these are approximate. So with that, they procured the food items, essential commodities. For some, it is medicine also. They really he work hard, you know. So with this, they procure the food items and they distribute. They visited each household and distributed these food grains. Then if the household has money, then they collect the money for the food grain delivered. But if there are some households who have difficulties in paying the cost, then they give them free of cost. So like that. And some, you know, like after 2 weeks of this lockdown, you know, the demand of vegetables, the greens were quite high. So during those difficulties, the task force arranged to get vegetable from other villages. Then they distributed to the community. They visited every household. So for now, I can point out only those 3 points for the initiative, though there are so many. Then the impact, also we have several impacts, but I will just select one, the impact and the coping strategy, right? Here, a daily wage earner in one village we visited, he earns about rupees 400 per day. He has no members. Yeah, since lockdown, all his family needs are provided by the local task force, he said, because he could not purchase. He has no money and he could not go out also. Then they provided, the local task force provided rice, vegetables, dal, and aloo, etc. Then they usually eat only rice and one side dish. That is their life during the lockdown. And he said, since this is his family condition, he said, I am more afraid of dying of hunger than COVID-19 infection. So this is the situation in the village. Like, let's say people, some of them are more afraid of dying of hunger instead of dying of COVID-19 infection. Then now let's go to the good practices again. But for this also, I have selected only one good practice to shorten the time. One thing I would like to point out is during this hardship, really, we could see resurgence of brotherhood. Resurgence of brotherhood. You know, the local task force will be looking around the non-Mizos who are stranded over here also. Then whomever they see, the local task force will go and give them food grains, supplies for their needs. Then another very good example I want to cite here is one of the villages we visited. The village name is Darlung village, which is under Ibok RD block. You know what I don't know how could they come up with this noble idea. One day, the local task force, the leaders of the community, they came to think of their brethren in Aizawl city. During the time, there was a high demand of vegetables in Aizawl city. So this resident, the community of Darlung village, they started thinking of how to help their brethren in the city. So they decided to collect all those vegetables, the greens available in their villages. Then they, as their report, they said one morning they make announcement through this public address system. Then they said, let us go and collect whatever we have and come back and give them to our brethren in the city, Aizawl city. Then that morning, they came all together in a community hall. Then they dispersed individually to look for different kinds of vegetables. Some of them, they will just go to their garden and get the vegetables. Some of them, they will go to the forest and get whatever items they could get, like banana blossom, the young rattan, and like other bamboo shoots. And some of them even go to the rivers and they catch fish. They catch snails and they bring back. And they inform us, you know, it's really heart touching. They inform us. Some of them even came back after midnight, early in the morning, 2 o'clock, with whatever they harvest from the forest. So the next day they brought the vegetables to Aizawl. Then they even, that is not enough for the whole community anyway, the whole Aizawl city residents anyway. So they drew a lot of for one community. Fortunately, Chanmari community got that lot. So they went to Chanmari community and they distributed. Then in return to that, without expecting, Chanmari community also, they gave them like rice, dal, like cooking oil, and some bread. And they took them back. They said, we don't need it. But the Chanmari, it's not like, you know, repaying of your goodness, but it is from our heart. So you have to take back. So they took it back, and they still reported that they even shared those rice, dal to their neighboring villages again. So we could see this, you know, interesting brotherhood very beautifully. So that is there. So we asked them the list of vegetable, the wild edible greens they collected. 24 I have here. If we have the slide presentation, then it can be seen there, the whole thing. But since there is no possibility, I have the list of 24 vegetables and edible items here. So this way, during hardship in the Mizo community, we see brotherhood. So there are so many things to share yet, but then since due to lack of time, maybe my presentation, I will just try to conclude my presentation now here. Yeah, we have faced hardship due to COVID-19, but fortunately, due to, you know, the hard work of all the government officials, then the local task force, and with the community, we did not have any extreme cases where people die of hunger. So together, we are able to, how do we get? We are able to fight coronavirus. So we are here today sharing our experience. So I think with this little experience, I end my presentation. Thank you, Sushi.
Thank you, Professor. Thank you so much. I was so engrossed that for a moment, I forgot that my duty is to not only to say thanks. In fact, I would like to highlight a few points which you have just added, and I was really engrossed in every point of you have shared. So first of all, a big thank you, and as rightly said by the professor, effort of Mizoram University for bringing up almost all stakeholders on one platform needs to be applauded. And secondly, Professor, thanks for sharing the case studies from Mizoram village, and especially organization of local task force was truly insightful. I deeply appreciate involvement of women and senior citizens because nobody till today has told us this. So, and three important things, in fact, amongst the key point which you have highlighted, in fact, to impact of and coping strategy and the good practices with simple examples were the touching points of your view presentation. So we have just heard, Professor, and realized that the disciplined, organized effort of villagers and the local task force and their wholehearted cooperation with the government agencies to face the challenges of lockdown has been a key to success. To sum it up till today, living in Aizawl, it is difficult to sometimes grasp the extent of problems being faced by the villagers of Mizoram. So thank you, Professor, for sharing your insight. So with this, we have the presentations from view presentations from all the panelists. So we are going ahead to part C, and I'll be addressing a few questions to a select group of the speakers at a time. But at any given time, if there is something you would like to share which is relevant to the question at hand, please do jump in. So are we ready? I want to listen yes from all the panelists. So are we ready? So these two questions first, thank you. These first two questions is for the community representatives on the panel. Pu Tato, Reverend Lauren Moya, Professor Lalun Thulanga, and Professor Lalni Lama. Question number one, what according to you has been the most important health initiative that has enabled Mizoram to keep its infected count down low? May I repeat it? What according to you has been the most important health initiative that has enabled Mizoram to keep its infected count down low? Any one of you can grab it.
To my understanding, to my observation, as I have already said, the charts appeal to its congregation for to observe social distance. At the same time, it also comes for NGOs. We all are in one accord, so to say, to keep physical distance from another persons. And that is one thing. Another thing that comes to my mind is that we, for a long time, we do not have our people coming back home from other states. But now, towards the end of May, things became a bit different. And that also, I don't know how we will say about that, but as far as, or as long as we keep physical distance, that minimize the increment of affected.
Okay, let me add one point. The discipline of the Mizo society that helped minimize the outbreak of this COVID pandemic. So Mizo people are self-disciplined. Then besides that self-discipline, the awareness created by the church, as we already know from the previous speaker, and the awareness created by these media people, then the NGOs, different NGOs on their respective places, they're creating awareness for this COVID pandemic. Thank you.
Thank you, Professor and Reverend, for beautifully presenting the answer. I believe the viewers are really going to enjoy it and can take a lesson from it. Going ahead, our next question is that that 2 weeks of complete lockdown, when the other states are having unlocking phases, what are your expectations from our small state of Mizoram with disciplined people? To repeat it. 2 weeks of complete lockdown when the other states are having unlocking phases, what are your expectations from our small state of Mizoram with disciplined people?
I think I may come in here, although I'm not a panelist as such. This coming 2 weeks of lockdown has been as a result of the suggestions from the medical people, because the infected people, as we all know, are those who are coming from outside the state. And in order to keep track of them, the first people who had come back, they had finished their quarantine and they are out in the community now. But now government felt that since at that time only RAT was done and RT-PCR was not done with them, community spread is maybe a threat with those people. So these 2 weeks of lockdown, it will be time for doing contact tracing of those people coming back and those who have finished quarantine. That is what I feel is the reason for this 2 weeks lockdown.
Dr. Sushi.
Yes, please.
Hello. Your question, I don't know if I will be able to answer, but I have something in mind. The
Please,
most effective health initiative, of course, there may be initiative from the government or at various level. But I feel community participation is the most, the most important here, because the initiative is there, but due to community participation, we are in this stage now.
Hello. Yeah. Very well said, Professor. In fact, Professor Dickey, I believe that the beautiful synergy amongst all sectors of society of Mizoram would make us victorious. And as you said that added to it regarding the three biggest health initiative, yes, we truly believe that the amazing community participation is the most unique aspect of our answer to the fight against COVID-19. So going ahead, the next question, our next two questions go to the head of forces and police, Poo Kuldeep Singh, Poo SBK Singh, and Brigadier Vinod. Question number one, what kind of efforts would be needed in the state of Mizoram to ensure safety and security in the post-quarantine world, and how do you foresee a return to normal? I repeat, what kind of efforts would be needed as forces head in the state of Mizoram to ensure safety and security in the post-quarantine world, and how do you foresee a return to normal?
Well, I'll take this question. See, it is generally said that many people have lost their jobs. So in the after the lockdown is lifted in the unlock period, it is usually expected that the crime is going to increase because people would like to have some money. But generally in Mizoram, that is not going to be true. For simple reason, because in Mizoram, as it has been very well explained, that the people have been fed. So no one has gone hungry as such. So that is one very, very important thing. Of course, after this, people come out of quarantine and start moving and there is unlock period. Of course, there will be rush in the market. There will be more vehicular traffic and all those things. So of course, we will gear up our arrangements for regulating traffic and for safety of our people. But again, as you may have noticed, that people of Mizoram are so disciplined that nobody honks on the road. The four-wheelers move in one line, the two-wheelers move in one line. So there is a lot of discipline on the road itself. So we are not going to have any such problems in Mizoram. I personally do not foresee it, but anyway, we are prepared for it.
Ma'am, as far as we are concerned, I think the precautions what the people are taking and will be part of our system. It will be part of our lives now. The social distancing, even in the operations, the masks, the sanitizing, and regular spread of awareness between to the border population will be a part of the duty. Secondly, those people who are coming into the state from leave, they will have to be medically checked, quarantined. I mean, it has to be rechecked, and then they should be put. They would be put on the duty, because as far as I am concerned, my job cannot be done by anybody else. And for that, even if one man is sick, he will make the entire team out of the place. So for that, we'll have to be sure. We'll ensure that the men are safe, so that the entire environment is not contaminated.
Just adding on to some few points. When the country was in lockdown, Mizoram wasn't, and but one could see on the roads or in the public the discipline of the people. There was still no crowding, and only the bare essentials moved out. Even the shops were opening every alternate days. I think that speaks of the prognosis post the quarantine period, what will be in state of Mizoram. Because when as I mentioned, when the country was in lockdown, we were not, but still we maintained a sense of discipline. And what is in the offing, we have got a trailer in this interim period. So I think hats off to people of Mizoram. We will come victorious in this period too. But of course, those precautions, as mentioned by the earlier, will be there to stay, because the country is going through a pandemic. But coming on to, as for the purely from as a border guarding force, I think we'll have to be extra cautious on the borders to ensure that nothing comes or infiltrates from the across the border. That we will take care, and we are poised for that. Thank you.
Thank you very much, Poo, SBK Singh, Poo, Kuldeep Singh, and Brigadier Vinod. Very well said. A well-fed public with discipline and ethical behavior and community participation enforced by churches and impactful NGOs, the YMA, would certainly help police and forces ensuring safety, security, and orderliness in the state. So being extra cautious across the state, definitely is your job, and you will do it excellently. So going ahead to the next question to you all, true success in implementation requires cross-sectorial collaboration. Can you share some important anecdotes of how this has worked behind the scenes with the state and community leaders? I repeat, true success in implementation requires cross-sectorial collaboration. Can you share some important anecdotes of how this has worked behind the scenes with the state and community leaders? Though some of you have already given this in your presentation, but I'm reiterating this for the sake of the viewers who are still engrossed with us and giving us very nice comments during the watching the chat as well. So please go ahead. Any one of you grab it.
During this period of COVID-19, BSF was directly in touch with the various organizations and various stakeholders. Like starting from the state government, we were in touch with the. We attended all the meetings of the Honorable Chief Minister, and the Honorable Chief Secretary. We were in touch with the state administration. Not only that, we were in touch with the district administration, because basically we were at my level, it was important to be in touch with state administration. But at the commandants and the company commander level, it was very important to be in touch with the district deputy commissioners and the superintendents of the police. And even at the company commander level, the SDOs, STPOs, we were in touch with that, so that whatever we were to do was communicated to them, so that it should be communicated down to the local last man. And if there was a problem anywhere, through them, it would come back to us. Secondly, we were in touch with the DGP was more than willing to help us because of our ADAM problems, the movement, the IG law and order. We were in touch with them for our own administration. And again, there are certain things which were to be implemented through them, or the requested through them. That has happened. And there are other, like Ministry of the local Ministry of Health and Family Welfare. We were able to get a lot of help. Ultimately, in the whole thing, we could not stay alone and work it out. It has to be the coordination between all the stakeholders, and we being one part of it, we require the other stakeholders to be with us and help us out. And that is what has happened, and that is what has got us through.
Yeah, I'll take that question. As I mentioned in my slide, there are two big cable companies here in Mizoram, one Zonet and LPS. One unique thing which never happened before was that these two firms, Zonet and LPS, worked together. We communicated each other and telecast that home crusade, which never happened before. We are really quite a fierce rival before, but now in this crisis, we came together and show public what was needed. Other thing is that as a journalist, as a media firm, there are instances where we need to we criticize the government, but under this situation and under the circumstances, we talk to each other. We have a good contact among the journalists, and we understand the situation of the government in dealing with the situation. So, in a nutshell, we work together very well as a media firm. Also, all the media firms work together and see how what can be done, what positive can be done. We can we can put out the negative parts, but we intend to put out all the positive impact and positive parts. So I think we also work very well in tandem.
Another one incident episode I would like to say that, when this lockdown started, so some medical equipments had come from outside, and the health department was not getting any labor to lift the equipment from the aircraft, put it in the truck, and also unload it and establish it. So I was requested by the health minister himself. Then, some people said, no, sir, why should we work as labor and all? Initially, one or two people did say, but then we talked it out, and then everyone happily worked. Almost 15-20 of the police personnel went and did everything, whatever was required to set up that medical unit. I think it was testing equipment unit, which was required to be set up. And when there was lockdown, there was no labor to pick up and everything. So what I would say that at such times, we do not have to, and as a police head, we felt that we should not draw lines, that this is not a part of police job and we should not do it, but whatever is required to keep the people of Mizoram safe and healthy, we should do it. And that is what we have followed.
Thank you, everyone. Coming to Kuldeep Singh, very well presented. As I belong to the same fraternity, I appreciate your answer till core. So moving on to the last question, which has come to my mind. But before that, yes, Mr. Tato jumped in and he gave what an example. Something to learn for media firms across the country. Being new to the state, I would truly admire, because I can see it myself, and admire this interesting resurgence of brotherhood amongst all the sectors. Who is BK Singh? As you said, that it seems that community policing is giving you a joyous part of your otherwise monotonous task. So going ahead to the last question, which I said that Kuldeep Singh has already answered in his well-given presentation, but it is for other two of you. While your men and women are on the front line tackling various issues of COVID-19, how do you ensure their safety and security and what precautionary measures and additional facilities have you provided them?
I'll take this question. This is a very, very important thing. In fact, first of all, the police persons, we are telling them, initially we took supplies of masks from the health department and we supplied to everyone who was working in the field. Then we started making masks on our own and we started supplying them. Some we also bought. So first of all, we gave masks to everybody. The second thing, we emphasized on giving them some awareness that what they have to do and what they should not do. The third, our own hospitals, our own pharmacist, nursing assistant, we also trained them. We have also prepared some beds in the battalions so that in case of any need, our people can be treated there also. Because if, say, God forbid, if something happens, we are prepared for that. And of course, we have also said that now we have to implement the lockdown thing on the ground. So if you are not yourself putting on mask in the field, how do you expect to find somebody? So you have to be a role model. So we are doing a lot of briefing, but of course, the problems are there. And the most important thing is keeping their morale high and telling them that, yes, we are there to help you and we are there behind you. So that we are doing in full measure. Thank you.
I'll add just 1 or 2 points to what both have covered already. One is, of course, as already alluded by the DGP sir, regarding awareness. Towards this, we have got our doctors who frequently visit all the isolated deaths and give them, I've been speaking to them, not only my troops, we have been even speaking to the villagers and the VLTFs also on various measures to be followed. Second thing, most important thing is discipline. I mean, the most unlearned until a person, he's himself convinced of the measures that has been implemented, nothing will work. In fact, in our own organization, we say, if somebody is doing under supervision, he's doing it out of fear, not of discipline. When somebody is doing it on his own without supervision, that is actual discipline. So until that kind of a self-discipline is brought in by everybody, we'll not be able to do our task. And of course, we have made them capable. We have given them the wherewithal to all ranks in terms of gloves, masks, and such kind of protective equipment to ensure that they are safe. And as far as our troops who are coming from outside after their duty, we are not letting them mingle with the rest of them who are inside our own garrisons. Because God forbid, if they have a contamination, they should be so that the spread is not they don't spread to the others. So these are some of the measures which we have followed to ensure that our own people are safe. Thank you.
Thank you, Poo, SBK Singh and Brigadier Vinod. I think training our men and women to obey the guidelines and getting them checked time to time and keeping their morale high are certainly the right answers to the question. Thanks for taking these questions and moving on to the other group. That is one final question to all the leaders present over here in the seminar. There is a lot of uncertainty around when things will back to normal. What is one message you would like to send to the people watching us today as they go back into another lockdown? Where should they be looking to get the accurate information? Any one of you can answer this. Thank you. Should I repeat it? There is a lot of uncertainty around when things will be back to normal. What is the one message you would like to send to the people watching us today as they go down into another lockdown? Where should they be looking to get accurate information? And what would be the strategies of local task force in bringing normalcy during unlocking?
Information sharing in Mizoram is not a problem at all, because any message gets so viral and so quickly through so many WhatsApp group, it is something unimaginable. You know, so that is not an issue at all, number one. Number two, that everyday basis, the DIPR, Honorable Health Minister did mention it, the DIPR takes out a kind of PDF which it circulates and it goes viral. It is in Mizo language, but I also asked my senior staff officer to send it to me because I understand a little bit of it. So it also goes viral.
Okay. This went.
Yes, I'll continue what Singh sir had said. Yes, the amount of information is really immense, especially in the social media, as I put out in my presentation. So we have to be really careful with our sources going forward, because there will be some negative things which will be out there also. So we have to be cautious. At the same time, we have to be positive. So we have to be very careful with the sources, like he said. The information from the government is very crucial. From the reliable media is also very crucial. That would be my thoughts. Yeah.
Go ahead, Mr. Brigadier Vinod.
Yeah, ma'am. Just 2-3 points. So I will be specific to the question. One is the precautions after the post-lockdown or post the pandemic. Be cautious. My only this thing is be cautious. Don't. It's not that the pandemic is just stopped and it will stop in one particular day. Be cautious even in the post-lockdown period. And the second thing is, as far as the sharing of which info to rely, I think most of us are aware, rely on the government sources which are authorized sources rather than the so many social media messages which are floating around. I would say the government sources are more reliable, and then we should rely on them for our whatever information we want to gather. Thank you.
Thank you all the panelists for being there. Thank you once again so much for your valuable time and staying with us throughout. You all deserve kudos and a huge round of applause to all of you.
Yes, thank you.
So be cautious, and pandemic is the new normal, and coming ahead, continue with your unique virtue of community participation. It's time to say goodbye, but before I say so, it is my duty to sum up the views. So I will say, wow. It was truly an intense but informative panel discussion. You all would agree with this. We hope that you stayed with us throughout. While there was a lot of information to consume at once, I'm totally floored by all that I have learned today and the different perspective I was exposed to. Hopefully with these concerted efforts, COVID-19 goes away and the Mizoram state emerges victorious. As a quick recap, this panel discussion covered some important facts, strategies, and statistics of the past and the future and gave us these ideas. Number one, Mizoram state acted with speed and urgency. National lockdown 1.0 was declared on 25th March 2020, while Mizoram state lockdown, the state government lockdown, started on 22nd March, 2 days ahead. The early decision made by the state government, made as early as on 9th March itself really helped. In the state, the implementation of the strategies of combating COVID-19 began as early as on 11th March 2020, which was not heard in any other state. So all community, government, and security stakeholders collaborated to implement novel strategies. That is our unique point of declaring ourselves Mizoram as a model state. Collaboration with local organizations and with the churches certainly helped the state in containing the spread of COVID-19, and therefore one positive case till today was successfully tackled. As standard Mizo community members, approx 10,000 precisely are entering now through domestic flights and trains, increasing the threats and cases up to 42 till yesterday. We are rest assured that the concerted effort of all stakeholders of the state in a disciplined and organized manner will succeed in containing the spread of COVID-19 in the state. And last but not the least, getting back to normal will require all of us taking necessary precautions. Today's panel discussion also gave us an idea that each one of us belonging to our society can contribute in a small way. So as a responsible citizen of the state and country, let us do our bit by staying home and staying safe. Kudos to the state government machinery, frontline warriors like you all, the churches and every community leader and member of the state for making Mizoram a model state in India in combating COVID-19. In my personal experience, living in Mizoram, I have found the Mizo people live simply, work humbly, and love genuinely. Thank you for being a model state, Mizoram. Hope you all have enjoyed today's session and making the most of the quarantine. Stay safe, stay healthy, and stay happy. Over to Professor Dickey for the final and formal goodbye. Thank you.
Thank you, Dr. Sushi. As an organizing secretary, I will just take this time to formally thank each and every one of the speakers as well as the participants. And I would also like to put on record our thank to our Honorable Minister who has given his time amidst all the busy schedule that he is having. And Dr. Sushi has summed up all the session, all the speeches, so I will not repeat that one. Just one thing that I want to share is that when it comes to pandemic, whether it's Mizoram or elsewhere, no place is safe. But if we all stick together, keeping safe physical distance, we will be able to come out victorious and beat this pandemic. And we should all ensure that we wash our hands frequently, wear our mask, and keep a safe distance. Before I end, I would like to say that for those who need e-certificate, please send it in the email of the organizing secretary within a week, and we will send it to your registered email. Thank you all. Take care. Stay safe.
Thank you very much. Goodbye.
Thank you. Thank you.